Hey, welcome back to the channel. In previous video, we already discussed exam guidance for mental health nursing. So in this video, we will discuss the same things for child health nursing. This will be your last stop for knowing all the guidance for your child health nursing for sixth semester. So let's begin this video. Hi everyone, my name is Tony Stark. Welcome back to the channel. Today's video is all about child health nursing for your sixth semester BSc nursing exam. I know most of you are confused about how to write CHN, what's the pattern, what kind of questions are asked, how the paper pattern looks. Don't worry, in this video I'll explain the full exam pattern, how to write answers for both disease based and general questions, and which topics to focus on for scoring high marks. So let's begin this video. First, we'll understand the pattern, like exam pattern. As per the new scheme, they included MCQs, right? So, as per that, we'll have two long answers, each carries 15 mark. So, I'll zoom this here. So, each carries 15 mark, a total 30 mark. Next comes short answers. So, 5 questions will be asked, 5 marks. So, total will be 25 mark. Very short will be 4 questions will be asked, each carries 2 mark, 4 2 8 and 12 mark. Like multiple choice will be 12 questions will be asked, each carries 1 mark, total will be 12 mark. The total duration of the exam is 3 hours, so you need to manage and maintain your time preciously. So this is a strategic time management for your CHN. You're spending at least 1 hour 30 minutes or 1 hour 20 minutes for long answers. It will be easy for you to complete all questions. I see mostly students leave 5 mark questions because they don't have time. I know mostly like after exams, students come near to me and ask me or complain about they don't have enough time to complete all questions. They left MCQs, they left 2 marks, 2 mark questions. So it's better to maintain time and it's better to attempt all questions rather than leaving a single question. Okay, if you are attempting, they'll at least give you 1 mark rather leaving that question blank where you'll get a 0. So for short questions, if you're spending for each question 8 to 10 minutes, it's better. Very short and MCQs will be around 15 minutes. That is very enough. How to write CHN answers? There are two main formats. Just like I mentioned here, also there are two main formats. For disease condition, you have different pattern, and for writing normal questions, where the content is more, you have to write that type of principles and management. For that, you have a different pattern for writing. So we'll see all those patterns. Here, for disease and condition based questions used when question is asked about a specific pediatric disorder or a disease. For example, the nursing here, I think you can't see here. Yeah, explain the nursing management of a child with pneumonia or describe the nursing care of a neonate with jaundice. If these type of questions are asked in the exam, this is the format you have to follow. First, you have to write introduction. What's the introduction for a neonatal jaundice? You have to write. Then you have to write a definition, causes, clinical features or symptoms, diagnosis, medical medical management. What all comes? Medical management, surgical management, nursing management. If your surgical management is not there, there is no need to write surgical management. Here we need to mention care plan. After the care plan, we have to write health health education conclusion. The introduction for 15 mark. For 15 mark only, you have to write the introduction. For 5 mark, there is no need to write introduction. Start with the definition. Okay. And what are the types of topics used for this type of format? Is pneumonia, diarrhea, malnutrition, neonatal jaundice, respiratory distress syndrome, RDS, seizures, and common communicable diseases. These are the common disease conditions. For those, you need to use this type of format. Okay. And when it comes to non disease questions or conceptual questions, for example, explain the principle of growth and development, describe the role of nurse in immunization. These kind of questions, if they're asking, you have to, for 15 mark, you have to start with introduction, you have to write a definition, objectives or purpose, main content. Here, for example, they are asking principle of growth. Now you have to write the principles of growth. What are the principles? You need to include all the principles. Then you have to write a nursing role after health education, after conclusion. For 5 mark, if they're asking only for 5 mark, definitely you need to, there is no need to write introduction, start from definition. These are the few topics you need to mention, like you need to follow for this kind of format, where growth and development, immunization, care of a hospitalized child, nutrition in children, play therapy, role of a nurse in under 5 clinic, and preventive pediatrics. These are the normal topics where you have to follow this format. Now we'll explain about a nursing care plan, how to write a nursing care plan in exam. You have to start, this is a format, nursing diagnosis, goal, here is a format, assessment, nursing diagnosis, goal, intervention, implementation, evaluation. There is no need to write a rational, that's keep aside and write remaining all. I already said how to write a care plan in previous video when we are discussing about mental health nursing, so there is no need to discuss it again. So high yield chapters which we need to focus mostly in respiratory disorders, immunization programs, congenital disorders, common infections, growth and development, and gastrointestinal conditions. Okay, these are the main topics you need to follow. Common mistakes to avoid: poor time management. I already spoke about this. People used to come ask me about, they left a few questions. This is because mainly they can't manage time. That's the main problem of further student. So it's better to maintain your clock and your time properly. Incomplete answers. Few people I observe, right, they started to write on long answers, they stuck there, they don't know what's next, so they leave 2 to 3 pages and they will start 5 mark question. So in a hurry they will complete 5 mark and short answers and MCQs, they'll forget about these 2 pages they left to complete for writing this long answer. So they won't completely write this question. Because of this they won't get marks. What they will think was, I started long answer, and they thought that they have finished that long answer and they will start writing short answers. Because of this also majorly people fail in, like in subjects, right? So when you start a question, try to complete that question perfectly. If you are not getting the answer at the time, leave on paper and try to remember that you left a paper writing that long answer or any short answer. Okay, don't leave a blank page in your answer key. Lack of structure, like they won't follow a perfect format, or they won't follow a perfect way to write a question. This is also a major problem in students. Generic response, mostly people don't write in a point way. Okay, they won't write in points, they'll always try to write in a paragraph. That's when you start reading. If it is a definition, you can't write in a point way, but if it is a principles, you have to write different points, right? Some people I used to see, they used to write in a paragraph, so that's a big mistake, that's a big no. Okay, ignoring mark distribution, like mostly people don't, like they will write a 2 mark, very, like I have a friend where he starts writing 2 mark, they'll he will write 8 papers, only 2 mark, 4 questions will be there, right? For each question he will at least consume a half a page, and he'll start writing in the next question in another page. That's not necessary. When you're writing 2 mark, start writing it. After one question, you have, if you are, that page is enough, you can write in next in that page only. For long answer and short, like in long answer and 5 mark questions, if you are completing in half a page, you can't write from the half, you have to start from the new page. For 2 mark and 1 mark if the page is enough, and if the half page is like if you're left with half page, start the new question there only. There is no need to turn back and start from the new page. Okay. Poor presentation, it's lack of knowledge and lack of attention to the answer. Essential tips for exam success, it's all things we already discussed. Your path to success, the consistency, consistent like a preparation, understanding, don't memorize, try to understand, practice time, like you have to spend at least a half an hour or 1 hour on each subject every day, so that you will have a proper knowledge regarding each disease. When it comes to your sixth sim, it's very important. Why? Because here only the major subjects land, like MHN and CHN and nursing management. These three subjects are very key topics for your entire nursing career, where if you want to go and work in a hospital, in a neonatal hospital, you have to know about child health. If you want to work in any other hospital, you have to know how a patient behaves, where MHN comes. And if you want to work in any other hospital other than psychiatry, child health, any other hospital, you need to know what's the nursing management, right? How to treat a patient, how you need to behave as a nurse, or what's our nursing policies. These all comes in nursing management. So sixth sem is a very important semester for your nursing career. So try to learn, don't just memorize the things. Try to understand the each and every disease. Try to learn what is the medication, what is the management for each disease, so that you'll have some career out of this. You can build a career out of this. And if you want to write any competitive exams, or if you want to go to any country other than India, these are the main topics they will focus. Okay. Already having a WhatsApp group where I am having for fourth sem, for sixth sem, and for second sem, where I provide notes, important questions, and this will discuss about each and every topic there, where the student have a direct connection and contact with me, where you'll get more response and you'll get more knowledge from the group. So if you want to join in the group, try to contact me. My number was there in the Telegram channel, and my Instagram also was there in the Telegram channel. I'll keep in the description box also. Please check on that. Try to DM me, and I'll help you and I'll guide you with this semester. Thank you so much for joining in this video. I hope you'll enjoy your next moment. Thank you so much. Bye.